Have you ever wondered what exactly is diabetes mellitus and why it is a cause for concern? Well, let's demystify this. Diabetes mellitus is a chronic condition that affects the body's ability to process sugar or glucose, which is our primary energy source. It's like having a car full of gasoline but no key to ignite the engine. There are two main types of diabetes. Type 1, where the body doesn't produce insulin, the hormone that allows cells to use sugar. Then there's type 2, where the body doesn't use insulin properly or doesn't produce enough. This type is more common and often linked to lifestyle factors. The prevalence of diabetes has been on a steady rise globally, and it's not just a concern for the elderly anymore. It's affecting people of all age groups, from toddlers to teens to adults. Now that we comprehend what diabetes mellitus is, let's delve into its care plan. The first step in the care plan for diabetes mellitus centers on its diagnosis. Why is this so crucial? Well, it's simple. The sooner we can identify this condition, the sooner we can begin to manage it and mitigate its effects. Now, how do we diagnose diabetes mellitus? Several diagnostic tests can help us, including the fasting blood sugar test, the oral glucose tolerance test, and the HbA1c test. Let's break these down a little. The fasting blood sugar test, as the name suggests, measures blood sugar levels after an overnight fast. If your blood sugar levels are high, that's a red flag. The oral glucose tolerance test is a bit more involved. It checks how your body handles sugar by measuring blood sugar levels before and after you consume a glucose-rich drink. Then there's the HbA1c test, which gives us a bigger picture by measuring your average blood sugar levels over the past 2 to 3 months. Once a diagnosis is confirmed, the next step is to devise a management plan. The second step in the care plan for diabetes mellitus involves making essential lifestyle changes. Now, you may wonder, why lifestyle changes? Well, it's because these changes directly influence your blood sugar levels. Firstly, let's talk about diet. A balanced diet, rich in fruits, vegetables, lean proteins, and whole grains, can help maintain stable blood sugar levels. It's not about completely eliminating certain foods, but rather about making healthier choices. Next, we have physical activity. Regular exercise, whether it's a brisk walk, cycling, or even dancing, can significantly help lower blood sugar levels. It aids in weight management, improves heart health, and boosts your overall mood. And speaking of weight management, maintaining a healthy weight is another key aspect. Excess weight can lead to insulin resistance, making it harder for your body to use insulin effectively. These lifestyle changes, when incorporated into your daily routine, can greatly help in controlling your blood sugar levels. Besides lifestyle changes, medication also plays a crucial role in managing diabetes mellitus. The third step in the care plan is the effective use of medication. Let's delve into this crucial aspect. Medication for diabetes mellitus is not a one-size-fits-all solution. They vary based on the type and severity of the condition. The two primary types of medication are insulin and oral medications. Insulin is a hormone our bodies naturally produce to regulate blood sugar levels. Some people with diabetes, particularly type 1, may not produce enough insulin. In such cases, they will need to take insulin externally, either through injections or insulin pumps. On the other hand, oral medications are usually prescribed for those with type 2 diabetes. These pills work in different ways to lower blood sugar levels. Some help the body produce more insulin, while others decrease the amount of glucose produced by the liver or increase the sensitivity of body cells to insulin. Remember, medication and lifestyle changes go hand in hand in the management of diabetes mellitus. The final step in the care plan for diabetes mellitus is regular monitoring. This is a significant part of managing your diabetes mellitus. Why, you may ask? Well, it's simple. Regular monitoring provides you with the necessary data to understand how your body responds to the interventions set in place, whether they are lifestyle changes, medication, or both. Let's start with regular blood sugar monitoring. This is crucial because it provides immediate feedback on how your body responds to food, physical activity, medication, and stress. It's like having a personal dashboard that tells you how well you're managing your diabetes. Next, let's talk about regular doctor visits. These visits are important because your doctor can assess the effectiveness of your management plan and make necessary adjustments. They can provide advice, answer questions, and help you navigate any challenges you may face. Routine lab tests can also provide valuable information. These tests, which usually include the A1C test, provide a long-term view of your blood sugar control. It's like taking a snapshot of your blood sugar levels over the past 2 to 3 months. So you see, regular monitoring is not just about keeping track of numbers. It's about understanding your body, learning from it, and using that knowledge to improve your health. It's about making sure that your management plan is working for you and making necessary adjustments when it's not. And remember, consistent monitoring is key in preventing complications and living a healthy life with diabetes. In conclusion, the care plan for diabetes mellitus involves 4 key steps. Let's take a moment to recap them. First, we have diagnosis. This is the cornerstone of any effective care plan. Without an accurate diagnosis, it's impossible to develop a proper treatment strategy. A diagnosis of diabetes mellitus is typically confirmed through blood tests that measure your blood sugar levels. Next, we shift to lifestyle changes. The importance of this step cannot be overstated. A balanced diet, regular exercise, and maintaining a healthy weight are fundamental in managing diabetes. These lifestyle changes help regulate blood sugar levels and reduce the risk of complications. Thirdly, we move on to medication. Depending on the type of diabetes you have, your doctor may prescribe insulin, oral medications, or other treatments to help your body use glucose more effectively. It's critical to take these medications as directed to control your blood sugar levels. Finally, we have regular monitoring. This is another crucial step in managing diabetes. Regular blood sugar checks, along with routine medical appointments, help track your progress and adjust your treatment plan as needed. Each of these steps is a piece of the puzzle in effectively managing diabetes mellitus. It's not just about taking medication or making lifestyle changes. It's about a comprehensive approach that involves regular monitoring and a commitment to your health. Remember, diabetes mellitus may be a chronic disease, but with the right care plan, you can lead a healthy and fulfilling life.